What I already do today with a mobile is pretty much everything from even getting in contact with instructors through email. I can access the Red River site from my mobile to check grades, note postings, updates. So I can pretty much do everything and even write notes if I wanted to on my mobile device.
Right now in the beginning stages, we've only developed a prototype, but the prototype so far will give students, essentially it's a glossary of terms that would help them describe their findings. So as they come into the clinical setting, they're working with their patients and they complete a full head-to-toe assessment on their patient during the day. This tool will allow them to break down that assessment into different areas of the body and be able to find the words to state what they've found or what they've assessed on their patient. So this is based on just the 5 main body systems that nurses would consistently document on. So we just have them listed from a head-to-toe kind of fashion, and if they wanted to go into we'll say the gastrointestinal system, they'd go here. The app is going to prompt a student, have you completed your gastrointestinal assessment on your patient? And the student would select yes. If they had selected no at that point, the app is basically going to prompt them to go in and complete an assessment because you can't document without assessing your patient first.
It was pretty straightforward. I'm pretty familiar with how to use an iPod, I guess, so that might have helped, but even for someone who has never used one before, I found it pretty straightforward, and even with a couple of simple directions, you'd be able to figure it out pretty quick. I'd like it to see if we could have actual images and pictures and sounds, and not something we'd necessarily do in the room with the patient, even something that we can take home with us. And yeah, we have limited time in lectures and in skills labs to even work on our skills, so to have that kind of mobile device with you just to supplement your learning outside of the classroom or the clinical setting.
I think perhaps the innovation in this project is the portability of providing students with a resource that they once had to bring via textbooks that weigh 100 pounds each that often get put into the corner of a room. Now they have that in their back pocket, in a pocket in their scrub pants that almost looks like it was designed for an iPod. I think from here, if we could go forward with this app, I'd like to see it implement a little bit more from other courses that students take, including health assessment or their nursing techniques, to be able to implement some of that practicality that the students were asking for, and also to add more media, to have images that come up and sounds available to students, just giving them more resources available and not just a glossary, but having video or the things that really excite students about learning and really make the classroom learning bridge into the clinical setting.
Documentation is basically the most important thing, and it kind of gets put on the back burner. And it's usually, like we said, left to the end of the shift. And I think if we had a mobile device, the convenience of going into the patient's room, as you're coming out, pretty much documenting on your mobile device what exactly you've seen instead of trying to remember what had happened from the morning 8 hours later.
I think some of the biggest challenges were not understanding the language of programming. And so as a nurse, I understand documentation. I know what that looks like when I'm in the clinical setting. I know the paperwork that I have to complete. I have the content, but how does this content work in a mobile device? So I think it was important to be able to outsource some of the requirements of this app in terms of both the graphics and the programming to people who do have the knowledge, who are capable and can help us translate that language from practical to real. Here's the device, here's what it can look like. I think Red River could be most proud of the fact that once this device was in students' hands, students actually saw its value and gave positive feedback, and students were hungry for more of it. They desired to have these types of tools in their hands, and supporting that and giving that to them just shows yet another way that Red River is meeting the needs of not only its students, but of the industry that we service and our students eventually work in as a whole.